All right, then. So the very first segment of the program this morning, we're looking at how technology is changing health insurance in Nigeria. Those of you who are here to plug into health insurance, there's a whole lot that you're missing out. But this morning, Bastion HMO Limited is taking us to the classroom to let you know what you can do with ease, especially with the use of technology. And joining me in the studios right now, Dr. Adeola Idowu is Head Business Transformation for Bastion Health Limited. Nice to have you in the building, Dr. Idowu. Good morning.
Good morning.
And how are you doing?
I'm doing great. Thank you for having me.
Let's touch down on the main subject this morning, and it's all about innovation and technology. So, how is technology transforming the health insurance industry in Nigeria?
I'll begin with health insurance and with technology. Claims processing has been more seamless and faster processing. We also have the telemedicine consultations, and this has shown that the future of health insurance is more digital and more efficient.
All right. So what are the benefits, really? What are the benefits of people tapping or making use of technology for health insurance?
Okay, I'll start with first, starting with the Bastion mobile app, which is downloadable on the Google and Play Store. You can access telemedicine within the app. And also, you can process claims faster, like I mentioned earlier. And we also have AI, which is artificial intelligence, that is infused into our systems.
Oh, you have that as well?
Yes, we do.
Okay.
This allows for faster processing of different parts or sections of your health insurance, from appointments to connecting with our customer service team.
So it makes it much easier?
Yes, it does.
Right. And are all this available in all the hospitals that you work with, or you're just looking at the back end now from Bastion?
So we have affiliations with different hospitals, pharmacies, clinics that we're affiliated to. And what we do is we leverage technology and our access to them to be able to bring healthcare to your doorsteps. So these are our partners. Enrollees or members can go to these hospitals and they can communicate to us via the mobile app.
So talk to me now. You have a mobile app. What's it called?
Bastion HMO.
And where can they get it?
You can get it on Google Play Store and on the App Store for iPhone users.
All right. So one thing is about accessibility for most of these app applications that I've developed. So how accessible is the Bastion HMO app on all those interfaces that one can get them?
So very accessible. From the Bastion mobile app, you can actually book appointments and you can see specialists in the hospital. You can access the telemedicine platform on it, giving you the power to sit in the comfort of your home and talk to a doctor online, virtually. And you can also keep track of your health records, which gives you a list of the different hospital visits you had, the care you were given. And if you are outside of your state or country, you can still pass that on to a different provider. We also have other wellness platforms embedded within our app.
All right, so let's touch down on the features now that you have in this app now. What are the features?
Okay, so we have telemedicine, we have claims processing. You can actually request for medication refills over there, and apart from the claims, you can also have a good list of your benefits and your details as regarding the policy you are subscribed on. So it is very vast and it's ever developing. We're incorporating new features day by day just to make healthcare easier for everyone.
And if I want to make a complaint, is there a way I can do that using this app?
Yes, sure, of course. We have a dedicated customer service team. You can reach out to us on our different social media channels. You can message us on Instagram, on X, and on LinkedIn, even on Facebook.
Right.
And we have a dedicated line, which is 0800 Bastion, which you can call to make any type of complaints. And you can also send us an email at wecare@bastionhmo.com.
Right. Let's talk about telemedicine now, because I know that one of the things you mentioned earlier on is telemedicine and virtual care. So how does it work?
So it's a very simple process. Imagine your Uber being in the realm of hospitality and health. So you simply log on into the app. Every member is eligible to access the telemedicine, regardless of plan. And you pick a doctor. So you also pick a time slot when you would like to chat with the doctor, and you can do a virtual consultation, which will be a video, and you can talk with a doctor and describe how you're feeling, and it can also prescribe medication at the end of your consultation.
So with the video interface,
yes,
the doctor will be able to give me, or perhaps tell me what's going on, what's wrong. He can give me proper diagnosis.
We have well-trained doctors on the Octodoc, so they are equipped with the knowledge to be able to handle most of these cases.
And do we have, these doctors, are they readily available at the back end there?
Yes, they are. So anytime you log on, just click the telemedicine, pick the doctor of your choice, put a brief description on what you want to talk about, and the doctor takes it from there.
All right, so for those who are listening to us this morning, Dr. Idowu, and they're still wondering, telemedicine, is that like a FAS or something? So how does telemedicine integrate with health insurance, and of course, what are the benefits?
Okay, so the way telemedicine works, like I said, is virtual. You don't have to physically go into the hospital. It will save you a lot of money physically going to the hospital, and even the processes at the hospital are more expensive than actually just sitting back, speaking with a doctor over phone, getting your medications delivered to you. So in terms of efficiency and in terms of the monetary aspect, it's a very good option to go for. So
from what you've seen so far, so good. Are people making use of this? Have you seen people that have come, that have given testimonies to say, well, I have gone through this, I've made use of the Bastion HMO app, and these are the benefits I'm getting?
I've got outstanding reviews from those that have actually used the telemedicine, and our doctors there that are in charge of the telemedicine, they respond on time. They give quick diagnosis. They are able to address your concerns and also take care of you. And you are also open to a follow-up after your initial consultation.
All right. So you did say earlier on that, of course, technology makes accessibility much easier for users. Is that correct?
Yes.
Let's talk about affordability as well. So how is the affordability equation coming into play?
So yes, we offer affordable, customizable plans at Bastion, and we give these different types of plans for individuals, for family, for seniors, and also for corporate organizations. We have the starting plan for individual, the lowest being 27,500, and on our Jade plan. And we have, like I mentioned, customizable plans, so it will suit your exact needs and how it will best fit your lifestyle.
So the minimum is 27,000.
Like I said, we have customizable plans, so depending on what you need.
So do we have plans that go as high as 500,000?
So no. So it depends. I described the different categories we have, but we do not have a plan of 500,000 yet.
Okay, so what does these plans cover, really? I mean, these particular plans that you talked about now, what does it cover?
So it covers a lot of things. We have preventative care, whereby you can have your healthcare checks.
The routine checks.
The routine checks. So for men above 50, you can do your PSA, which is for the prostate.
Prostate, right.
Yes, you can do a lot of high blood, your blood pressure check, your glucose check, to be able to ensure that you are well and good. And we have also laboratory investigations, a long list of them. So most of the investigations you do at an hospital, when you go for a visit, we cover them.
They're part of this coverage, right?
Yeah, they are part of the coverage.
What about surgeries? Are they also covered with all these plans?
Yes, to the extent of your limit within that plan. So depending on the particular plan that you pick, we cover surgery to a certain limit, and we are going to state the limit you'll be able to reach based on that surgery.
So things like appendicitis, that's covered?
Appendectomy.
All right. But major surgeries aren't covered, right?
So it depends on what you term as major, because there are a wide range of surgery. The neurosurgeries, of course, might be more expensive, running into millions, but to a good extent, we cover as much as we can.
Yeah, but for, pregnant women who are doing
Cesarean section.
Yes.
Okay, yes, we do cover them too. We do.
Ah,
Yeah.
okay then. Lagos Traffic Radio 96.1 FM. This morning we're talking how technology is transforming health insurance in Nigeria. And Dr. Adeola Idowu is head business transformation for Bastion Health Limited. He's in the studios this morning, and some of you are connecting with us. This one says, "Good morning, Victor and Dr. Idowu. Will wearable tech be integrated into insurance plans soon?" Can they send that one in from, where is this? Computer Village. All right. Thank you so much. So is there anything like wearable tech?
So I'm imagining what he's talking about, wearable tech, like your smartwatches being able to. So depending on the design of the smartwatch, you may be able to connect to the app and see some notifications.
Wow.
And so we are getting there. Nigeria has evolved rapidly, and we are really doing a great job.
All right. Another one here says, "Good morning. Are we likely to see peer-to-peer or micro insurance platforms thrive?" You didn't put your name. Thank you so much. Peer-to-peer.
So
what does that mean?
So this is people selling insurance to insurance, and when you say micro insurance, it goes down at a more affordable option. One of the mission of Bastion Health is to transform healthcare in Africa, and we are looking to cover as many people as possible. Our vision being affordability and accessibility, and microinsurance is definitely one of the things we are looking at.
All right, this one here say, "Happy New Week in the studios. What is the biggest challenge in getting Nigerians to trust digital health solutions?" Akman is sending that one in. Akman, thank you so much. All right, so what was the challenge for digital health solutions like this?
So, a couple of people might be wondering, okay, do I have access to internet to be able to log into the app when I'm doing this virtual consultation? Will I have good network to have a good video consultation? Our data, is it safe with us? We have one of the highest standards, and we are making sure that any health data that is kept with us is secured, and we are protecting your data.
Well protected.
Yes.
All right. This one says, "Good morning, Victor. How is technology impacting premium pricing?" So is there any role that technology can play on premium pricing?
Yes, it can. The major benefit of technology is to make rigorous processes easier. So
I'm wondering, this person might be asking that, if I make use of technology, shouldn't it be cheaper?
Yes, and a good example is the telemedicine. If you are doing a virtual consultation, it will be cheaper than going into the hospital.
You mean it?
Yes.
All right. This one says, "Good morning, everyone. Do you think tech helped reduce fraud and abuse in the system?" Ebuka. Okay. So do you think tech, maybe he's trying to say, tech will help reduce fraud and abuse in the system? Ebuka, send that one in. All right. So
yes, definitely. So with the data on our back end, we can monitor how claims are being processed, how medications are being requested, and we use all these data to ensure that fraudulent practices are not going into play while we are dishing out the healthcare.
Let's round this off right now. So what's your message to our people, even as we round up the segment of the program?
So I would say health insurance is evolving, and you don't want to get left behind. Get on board the Bastion Health train. Explore our different plans on our website, which is www.bastionhmo.com, or also within the app where it is integrated. Also, you can reach out to our dedicated customer service. You can message us on our Instagram, X, LinkedIn, and you can also call us on 0800 Bastion. If you want to reach us via email, our email is wecare@bastionhmo.com.
We'll leave it at that for now. It's nice having you in the building. Thank you so much for being here.
For having me.
Okay, I've been speaking with Dr. Adeola Idowu. He's head business transformation for Bastion HMO. And this morning, we've been able to reflect a bit on how technology is transforming health insurance in Nigeria. A brief break when we return. Quickly, we do our birthdays before we switch to the Latif Jakonde Leadership Summit, which comes up shortly.